Hey everyone, and welcome. Today, we are pulling back the curtain and taking a peek inside your medicine cabinet. We're going to figure out how some of the most common medications out there actually work. Let's get right into it.
Yeah, if you've ever had that thought, you are definitely not alone. It's so easy to just see a bunch of bottles with complicated names. But inside every single one is a tiny, super specific tool designed to do a really complex job in your body. By the time we're done here, you're going to see that cabinet in a whole new light.
So here's our game plan. First, we'll tackle the everyday battle against high blood pressure. Then we'll call in the specialists for bigger fights. Think cancer and diabetes. After that, we're going to cover some absolutely crucial safety rules. And finally, we'll talk about the most important person on the entire healthcare team, and that's you.
Okay, first up, high blood pressure or hypertension. It's one of the biggest reasons people take medication every single day. And the strategies these little pills use, they are absolutely fascinating.
The easiest way to think about this is to imagine your body's blood vessels as this huge, sprawling system of pipes, kind of like plumbing. Now, if the pressure inside those pipes gets too high for too long, it starts to cause some serious damage. So the whole goal of these meds is to bring that pressure back down to a safe level, and they have some really clever ways of doing it.
Okay, so this is super cool. We're looking at two different game plans for the exact same problem. On one side, you've got the ACE inhibitors, like Lisinopril. We can call them the relaxers. They basically tell your blood vessels to just chill out and widen, which gives your blood more room to flow and, boom, lowers the pressure. The classic telltale sign you're on one? That annoying persistent dry cough. Then on the other side, you've got beta blockers like metoprolol. These are the calmers. They go straight to your heart and say, hey, let's just slow down a little bit. This reduces how hard the heart is pumping, which lowers the pressure. For these, you might notice you're feeling a bit more tired or that your pulse is a little slow.
All right, let's bring in another key player, diuretics. You might know them as water pills. Their main job is to help your body flush out extra salt and water. This reduces the total amount of fluid in your plumbing, which, you guessed it, lowers your blood pressure. But, and this is a really big but, they're not all created equal. This table shows a critical difference. Drugs like Furosemide and HCTZ are workhorses, but they can make you lose potassium, which is a super important electrolyte. That's why your doctor might say to eat more bananas. But then you have Spironolactone, which is the total opposite. It's designed specifically to be potassium-sparing, meaning it actually makes your potassium levels go up. It's a perfect example of why you have to know the specific details of your meds.
Okay, so we've covered the daily maintenance crew. Now it's time to call in the specialists. These are the medications designed for really specific, really complex missions inside the body. You know, treating cancer is rarely about one single magic bullet. It's more like a coordinated three-step mission. Step 1, you send in the attacker, a drug like Cisplatin. It goes right into the cancer cells and messes with their DNA so they can't copy themselves. But that powerful attach can cause collateral damage, like really bad nausea. So for step 2, you bring in a defender, like ondansetron. It blocks the signals in your brain that make you feel sick. And finally, step 3, chemotherapy can weaken your immune system. So you bring in a rebuilder, like Filgrastim, to tell your body to start making more white blood cells to fight off infection. Attack, defend, and rebuild. It's a brilliant strategy.
Now let's switch gears to diabetes and insulin. With insulin, timing is, well, it's everything. This timeline lays it out perfectly. Up top, you've got rapid-acting insulin. This is your mealtime insulin. You take it just before you eat, it starts working in about 15 minutes, hits its peak power in an hour or two to handle the sugar from your food, and then it's gone. Then you have long-acting insulin. This is your background insulin. It gives you a slow, steady, peakless supply for a full 24 hours, just like a healthy pancreas would. Using both together is how you mimic the body's natural rhythm.
Okay, knowing what a drug is supposed to do, that's half the battle. The other half, which is arguably even more important, is knowing how to use it safely. And these aren't just suggestions, they are critical rules of engagement.
Some rules in medicine have absolutely zero room for error. This is one of them. It's talking about potassium chloride, that same electrolyte we mentioned earlier. When it's given through an IV, it has to be diluted and infused really slowly over a long period. Pushing it all in at once, an IV push, can literally stop the heart. Instantly. It's one of the most serious warnings in all of medicine for a reason.
Let's take a look at a common blood thinner, Warfarin. It works incredibly well, but it demands respect. There's a strict safety protocol. The number one risk, of course, is bleeding, so you need constant monitoring with blood tests. But look at that diet point. It's fascinating. It doesn't say avoid vitamin K. It says maintain a consistent intake. Why? Because your dose is carefully balanced against your normal diet. If you suddenly start eating tons of spinach one week and none the next, you can throw that delicate balance way off.
So what's with this number? 4 to 7? Well, that represents the very, very narrow safe zone or therapeutic window for magnesium sulfate when it's used to prevent seizures. If the level is too low, it won't work. But if it gets just a little too high, it can cause really dangerous problems, like stopping your breathing. The balance is so incredibly delicate that the antidote, calcium gluconate, is always kept right at the bedside, just in case. It's a perfect picture of medicine as a high-stakes balancing act.
And all this talk about balancing acts brings us to our final, and honestly, most important section. All this knowledge isn't just for doctors and pharmacists. It's for you. Because you are a vital, active member of the team.
There's actually an official term for this, patient teaching. But don't let the formal name fool you. All it really means is the process of getting this essential, life-saving knowledge from the healthcare professional to you. It's not just a friendly chat. It is a core part of safe medicine. It's your playbook.
So what does this look like in the real world? It looks like this. These are your cues, the signals your body might send that something needs to be checked. That dry cough from Lisinopril. It's not just an annoyance, it's a known side effect you need to report. Muscle cramps could be a sign your potassium is low from that furosemide. And for a drug like montelukast, it is absolutely critical to report any changes in your mood. Your personal experience is priceless data.
And really, that's what this all boils down to. When you understand the why behind your medications, it completely changes the game. You go from just following instructions to being an active, empowered partner in your own health. This knowledge is your best safety tool, bar none.
When you really think about it, it's not a fancy scanner or a supercomputer in a lab. It's not locked away in a pharmacy. It's actually something much, much simpler than that. And it's something every single one of us has.
It's your voice, asking questions. Why am I taking this? What should I be looking out for? Hey, I've been feeling kind of weird lately. Could it be my new medicine? Those questions are the absolute foundation of medication safety. So please, be curious, be engaged, ask your doctor, ask your pharmacist, and be an informed partner in your own care. Thanks so much for tuning in.